Hi, I'm Jessica Franklin, and today I will be talking about the birth control pill. The emergence of the birth control pill into women's lives in the 1960s will be remembered as an extremely liberating time for all women. This was the first time we saw a type of oral contraception that assisted in preventing pregnancy. The invention of the pill was a huge discovery that both positively and negatively affected the world of contraception. Although there are risks associated, the pill is constantly undergoing a tremendous amount of research to perfect it in the future. Before the development of the pill, women used a variety of different birth control methods that were extremely dangerous and ineffective. In the early 1950s, scientist Gregory Pincus approached the pharmaceutical company J.D. Sturley about funding research for oral contraceptives. During this time period, few wanted to be involved in the research for oral contraceptive. It would be a huge risk for any company to take on due to people's strict opinions on anti-birth control. A chemist by the name of Frank Colton created an effective compound that helped prevent ovulation in females. The pharmaceutical company finally took notice of women's desire for a simple form of contraception in 1960 when the pill was approved by the FDA. Within 2 years of government approval, the pill passed through the lips of 1.2 million Americans every day. This was a huge accomplishment in contraception and continued with many improvements in the future. Understanding how birth control works is an important part of its use. The pill contains hormones to change the way the body works and prevents pregnancy. The hormones found in the pill have vital control over the function of a woman's ovaries and uterus. Most birth control pills are combination pills containing both estrogen and progesterone to prevent ovulation. Depending which type of woman is prescribed, she will stop taking active pills for a full 7 days or take 7 pills at the end of its cycle. It is hoped that after approaching the 7 days at the end of a pack, a woman should begin her menstrual period. This chance decreases if the pill is not taken daily or is skipped. Over the course of 1 year, about 8 out of 100 typical couples who rely on the pill to prevent pregnancy will have an accidental pregnancy. The pill is an extremely effective form of birth control if it is taken correctly. Since the pill has been introduced, it has been one of the most widely researched medications on the market. Besides preventing pregnancy, there are numerous other benefits to the drug. One alternative use is regulating menstrual cycles. This can be a great benefit to women whose cycles come too infrequently and for those who want a lighter and shorter cycle. It can also provide extreme relief for women suffering from painful cramps. Another beneficial health advantage of the pill is its possible reduction in chances that women will be susceptible to certain cancers. Women who use the pill for 3 to 4 years can decrease their chances of ovarian cancer by 50% if they take the pill. The use of the pill for at least 2 years reduces the risk of cancer by 40%, and for 4 more years reduces the risk by 60%. This again is a huge health benefit of the pill, which women should be aware of. One aspect that positively influences young people to take the pill is its treatment for acne. Acne for many can be embarrassing and very hard to control. For moderate to severe acne, which other medications can't cure, birth control pills may be prescribed. Major to moderate acne can greatly decrease with the use of the pill. The question of whether or not the pill affects fertility is often expressed by future mothers. With the research conducted, the pill has been shown to have no effect on the future fertility of a woman. Many women do not notice, however, that it may take 2 or 3 more months after stopping the pill to become pregnant. Overall, the effects of birth control can vary from person to person and has an abundance of health benefits. With any medication on the market, there are many health risks involved. When the pill was first introduced, it was given in high doses, 10 milligrams per pill. Reactions to the pills were extremely dangerous, and it wasn't until the 1980s that we began to see a decline in the dosage of the pill. About 40% of the women who take birth control still have side effects during the first 3 months of use. One extreme risk is the chance of causing heart attacks. Studies have shown that smoking dramatically increases the risk of heart attacks in women aged 35 years or older. This is why pills are generally not prescribed to women in the age group who smoke. This statistic shows that women in the pill who smoke need to keep an eye out for their overall health while on the medication. Another extreme risk associated with the pill is its increase in blood pressure. Women taking birth control pills usually have a small increase in blood pressure. Blood clots can be an associated health risk with the pill. Women taking it are slightly higher risk of having clot in their legs or lungs. However, the risk is more prominent in women who have prior clotting disorder. Other risk factors include obesity, older age, having several members of family who have blood clots before, and having to sit for a prolonged period at a time. There seems to be prior health issues which make a person more susceptible to blood clotting. Some small yet uncomfortable risks can be associated with the pill as well. It can trigger an onset of painful headaches along with nausea and vomiting. For many women, physical appearance also means everything. Unfortunately, the pill has some physical risks involved, weight gain being one of them. Many women reported an increase in their weight during and after the pill. Weight gain is often caused by fluid retention induced in the thighs, hips, and breasts. This increase in weight can also be due to the reduction in physical activity as well as an increase in appetite often associated with the pill. The final impact from the pill could be an unplanned pregnancy. There are many ways a woman could reduce these chances. When first starting the medication, it's important that another form of contraception is used for at least 7 days before relying solely on the pill. If the dose is skipped or not taken daily, a woman is not prevented from pregnancy. Failure to take the dose properly can increase a woman's susceptibility to pregnancy. The original idea of the actual pill is slowly diminishing. Several promising techniques that last longer, have fewer side effects, and are easier to use are making their way from the lab bench to bedside table. Women need something more reliable that doesn't need to be taken daily. One new contraceptive item hoping to replace the pill is called the annual ring. The ring contains hormones to halt ovulation for that month. The ring lets the woman be in control. The ring can be inserted monthly, and it can be taken out every 3 weeks. This ring can also be reused up to a year. This would cut down on frequent trips to pharmacy to renew the prescription each month. A futuristic form of the pill that we might see within the next few years would involve dabbing a small amount of gel on one's abdomen daily. The gel contains a new type of progestin, estrogen, that can be used topically. Majority of women found the gel easy to use, and this form of birth control seems to be the easiest one so far with little side effects. In regards to the future of the pill, we are looking at medical research to provide us with medications that have fewer side effects and come in simpler form. One controversial issue in our government today would be to provide free birth control pills for women. One premise of the new health care reform law is that every insurance policy must provide free contraceptive services to those who want them. This is a great idea for women who financially have difficulty affording the birth control pill. This law would affect the health insurance coverage employees receive from their employers. Along with this new plan comes much opposition. Catholics and other religious groups have voiced their negative views on the issue. Also, taxes might go up to cover the cost, which is a downside for taxpayers. Regardless of the opposing argument, birth control can be expensive monthly costs. This new plan would cut down price and make the pill more accessible to all. It's truly amazing to see the journey and transformation that birth control pills have taken on. The invention of the pill was a huge discovery that positively influenced the world of contraception. Regardless of the negative views on birth control pills, it continues to be a reliable form of contraception for many, if used accurately. I believe we will continue to see innovative forms of the pill in the future.